So we're going to start with gross anatomy with a vertebrae. And if you want to be able to jot notes along the way, I've posted a link in the notes section where you could download this exact sheet and write along with me. So the vertebrae includes 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 4 coccygeal vertebrae, which give us the 33 vertebrae we have in total. The sacral vertebrae are actually fused vertebrae. And so let's look at some of the features. So this is the general vertebrae structure. So we're going to have this big area right here as the body. This hole right here is the vertebral foramen. And what you should know is the body itself, it's used to support the weight. So as each vertebrae are going to land on each other and stack up, we're going to see that the weight is placed on the body. The vertebral foramen, it's where the spinal cord is going to pass through. Next we have the peduncles, or pedicle. And if this was a 3D drawing, it would be the structure there that's between the two condyles. And the pedicle is basically, you can almost think of it like an arm. Next we have the lacunae. Oh, sorry, not the lacunae, the lamina. And this is basically the side walls that's going to lead you into the spine, or the spinous process. Next we have the transverse process. And that's basically it for the naming portion of the vertebrae. As we go further into the different vertebrae, we're going to have to know different parts. So we'll have to know, another name for the body is the lateral mass, and this is typically seen in your atlas, and it's used to support the weight of the skull. So we're going to actually go into the atlas and axis, which is C1 and C2. So the way I remember that the atlas is C1 is, if you think in terms of the alphabet, T comes before X. So atlas would be the first, because T becomes before X. So since T is alphabetically comes before X, it's C1. Compared to the other cervical vertebrae, one thing that you should note is that the atlas does not have a body. So as you see in the general structure of the vertebrae, there is no body in the atlas. There's also no spinous process. So those are some big things to take note of. Also, right here we have the superior articular, and the two of these superior articulars are what's going to come in contact with your occipital bones. So it's going to actually come in contact with the skull, and it's going to actually support that weight. And what these condyles allow, or what these articulators allow, exactly as it sounds, it's going to articulate. So it means it's going to allow for an up and down movement. So that's the key thing about the atlas that you need to know. So just know the components of the atlas as well. We're going to have a lateral mass, and that's going to support the weight. And usually the lateral mass, and unfortunately on this drawing, is a little harder to see. It's basically the structure that's behind the superior articular. So it's the curvature that's going to support the mass. Then we have the inferior articular, which is going to be on the lower portion of this vertebrae. And this is what's going to come in contact with the axis. There's also a transverse process, and the transverse process is going to be right around here, and what that's going to do is this is going to allow for muscles to attach, and when the muscles attach, that's going to allow that control for the head movement. You have your transverse foramen, and the transverse foramen is going to be what is going to allow the vertebral arteries and veins to pass through the vertebrae. And so you're going to find this foramen throughout all of the vertebrae. And then, as we know from before, the vertebral foramen, and that's going to be where the spinal cord passes. Now let's move on to the axis. The important feature that's going to help you distinguish that it's an axis is this thing called the dens right here. And the dens is very important because it's going to allow for that the side-to-side rotation that you see when you move, when you're shaking your head. No, it's the dens that's allowing you to do that. It's allowing that right to left rotation. Again, with this, we do have a transverse process. It's actually going to be right below here. And the transverse process is going to be the attachment site for the muscles that are going to move the head and neck. So they're very important. And I know I haven't drawn it, but right around here is right where you're going to see the transverse foramen. And as you know, same as before with the atlas, the transverse foramen is going to be what allows the vertebral artery and veins to pass through. And then we have the vertebral foramen, and in this drawing it's not that apparent, but if we were to rotate this axis 180 degrees, right behind the dens there is a transverse foramen that's going to allow the passage of the spinal cord. Sorry, not transverse foramen, vertebral foramen that's going to allow it. Next we have the vertebral arch, and that's going to be made of the two peduncles, or pedicles, the two lamina, and the one spinous process. So there is a spinous process on this. So if we were to rotate this again, on the opposite side, we're going to see a spinous process that it looks sort of like this. So this right here is the spinous process. And usually the spinous process is what's going to extend from the vertebral foramen. And the spinous process is typically the site where you're going to have ligaments and muscles attach, and this is going to also allow for the movement of the head. This is also something that's going to be seen throughout the other vertebrae. Remaining characteristics for the other cervical vertebrae are that they have typically smaller bodies, and if you think about it, if we're looking at the cervical versus thoracic, the cervical vertebrae the body doesn't need to be nearly as big because it's not going to support as much weight as the thoracic is. So it's going to have smaller bodies. The arches are going to be delicate. A key feature is exactly how I drew the atlas's spinous process. You see how it has the two here. It's called a bifid spinous process. So you're going to have like this two, or the split of the spinous process. And also the spinous process will be elongated. Now when we go into the thoracic vertebrae, it's the middle portion of the vertebrae, meaning that if we were to break up the spinal cord, the middle portion of the spinal cord would be known as the thoracic. What's kind of a give me in terms of the name is that the thoracic would mean your rib cage. So it's going to have this area right here which allows for connection for the ribs. So it's going to articulate with the ribs. So these heart-shaped facets, as they're called, are the site for the ribs to attach. They're called actually the transverse costal facet. And facet just means heart-shaped. So it sort of looks heart-shaped. And as I said, this is where the ribs are going to connect. Within the thoracic, the transverse processes are prominent, and they're going to extend posteriorly. They also serve as an attachment for the back muscles. So the back muscles are going to be able to attach to the transverse processes, and they are going to allow for, not only control of the muscles in terms of flexion and extension of the muscles. It's also going to allow for, range and motion that you see, either if you slouch or if you stand up straight, or if you're rotating your back. The spinous process, which you know is right there, it's going to be a downward posterior projection. So if you remember the cervical, it's going to be outward. The thoracic is going to be sort of angled down, and it's again the site of ligament and muscle attachment. Now if we look at the lumbar is going to be, it's going to have the larger bodies. So a trend, as I said, was as we're going from the cervical down, we're going to see the body increase. So a way you can know that you've gone from the thoracic to the lumbar is the lumbar body looks more like a kidney shape, while the thoracic is going to be oval like this. So if you see it on a practical and you see a kidney shaped, automatically know that you're in the lumbar region. The pedicle is going to be smaller, so we're going to have a smaller pedicle, and this is more, if you think about it, as this body grows, it's going to kind of shift the pedicle, so it decreases the size. The transverse process is out here. So this transverse process that we see right here on the lumbar is going to be shorter, and it's also going to be thinner. The spinous process is going to be short and to the point. So if you think about it on your back, do you want your spinous process to be long or short? You want it as short as possible because you don't want, your spinous process kind of sticking out. And again, this is really for stabilization of your lower back muscles. Now if we look at what's going on between each vertebrae, so this drawing right here is fairly crude, but if we were to have two vertebrae stacked up just like this, and we were to wonder about the cartilage, well, on the inside what we're going to have is what's called the nucleus pulposus, and on the outside we're going to have the nucleus fibrosus. And if you think about it, if something is fibrous, it's going to be tough. And so you can almost think that automatically one of the main components, so this area that I've drawn is the intervertebral discs. So inter means within, so it's between, so it's between the two discs. So the nucleus fibrosus is the tough outer component. The inner component is the shock absorber. And so if we think about every time we walk or make any movement, there has to be some kind of shock absorber to control the amount of pressure that's going to be placed on the spinal cord. And what happens is the nucleus pulposus is going to help with absorbing some of the impact as we walk. Now, the big concern is if the nucleus pulposus starts to leak. So say that there's some sort of rupture and this fluid and this starts to leak, what's going to happen is it's going to apply more pressure to the nerve root. And so people with back pain, it's typically because of the nucleus pulposus. Or it could be that the nucleus fibrosus, you have a rupture and the nucleus pulposus is wanting to leave out. So this is going to impinge on the spinal cord, or the spinal nerves. Next, if we were to look, imagine that we had more vertebrae along this this thoracic vertebrae. Along the vertebrae, there's the posterior longitudinal ligament, and this is going to sit within the vertebral canal, and it goes along the body of the axis of the vertebrae between the pedicles. And then you have the ligamentum flavum, and that's going to connect the lamina and the pedicles together. So we have our pedicle right here in our lamina. The muscle, or the ligament that's going to connect that, is going to be the ligamentum flavum. So it's going to basically go along here. So if we think about our spine, so if we have our spine, imagine it like this. The ligament that's going this way is going to be the ligamentum flavum. The ligament that's going to go along the spinal cord is the posterior longitudinal ligament. Now, if you think about it, the name itself says it's long. So if something's really long, it's going to go the full length. So just remember, long goes with long. So the posterior longitudinal ligament is going to go along the vertebrae. The ligamentum flavum is going to go as a cross section almost, because it's basically going to go from here to here. So it looks almost like this basically. The other thing to know is two abnormalities or defects are kyphosis, actually three, I'm sorry. Kyphosis, lordosis, and scoliosis. Scoliosis you've probably heard of. It's when the curvature of the spinal cord is mediolateral, and it's something that's commonly seen. Kyphosis and lordosis, it's a little different. Kyphosis and lordosis, they're going to affect the thoracic and sacral curves. And so if you see someone that's bending forward a lot and they can't really bend back, that's an exaggerated form of kyphosis. Lordosis, on the other hand, it's going to affect the cervical and lumbar curves. And as the name says, you're looking towards the heavens or Lord. And so an exaggerated lordosis is someone who's going to have an arched back and their head is going to always look towards the heavens or look towards God. So that would be lordosis. So that's the end of the video on the vertebrae. As I said below, I have posted a link. It has my notes. It also has this image right here without any notes on it. If you like the video, hit the thumbs up. If you have any questions, comments, leave it below. If you like the channel, please subscribe.